Herniated lumbar intervertebral disc. Background. Spinal discs play a crucial role in the lower back, serving as shock absorber between the vertebrae, supporting the upper body, and allowing a wide range of movement in all directions. If a disc herniates and leaks some of its inner material, thought the disc can quickly go from easy daily life to aggravating a nerve, triggering back pain and possibly pain and nerve symptoms down the leg.
Hernia is described as a protrusion of an organ beyond the cavity which normally contains it. Such condition can also involve discs in the spine. A spinal disc serves as a cushion between the two vertebrae. When the outer part of the disc degenerates, the inner part can rupture or bulge. This bulging is called a herniated disc. In many cases, herniated discs recover without any intervention or through medical treatment. If non-surgical treatments haven't improved the condition of the disc after 6 weeks, surgery can be done. Diagnostic testing results must also support that the herniated disc is treatable with surgery. The different types of surgeries for a herniated disc are open discectomy, endoscopic microdiscectomy, percutaneous discectomy, laminotomy and laminectomy. In open discectomy, the herniating content that oppresses the nerve or the spine is removed. Other oppressing factors such as spinal stenosis are also managed. This procedure is considered as the most effective type of surgery for a herniated disc. Under general anesthesia, a small incision is made over the center or right of the back where the herniated disc is located. Once the herniating part has been removed and pressure is relieved from the nerves, the incision will be closed. The endoscopic microdiscectomy is a type of surgical procedure for a herniated disc, like an open discectomy, but a smaller incision and an endoscope or microscope is used. Instead of cutting through the muscles and tissues, they are just separated to allow the passage of the endoscope. In the spine, the same procedure is used as in open discectomy, but due to limited space, such technique can't be used in everyone. Percutaneous discectomy treats a herniated disc by reducing the size of the herniation. In this surgery, a special tool is used to remove the herniating disc tissue by heating or scraping it. It is considered less effective than open discectomy and can't be performed in all patients. Laminotomy and laminectomy are types of surgeries for a herniated disc that are done to relieve the pressure over the spinal cord or nerve root. These options are executed in very large herniated discs or spinal stenosis, for example due to arthrosis. In laminotomy, a part of the lamina is removed. The lamina is a thin part of the vertebra that encloses the spinal cord. In laminectomy, the entire lamina of the affected vertebra will be removed along with some thickened tissue. You are advised to contact your treating physician for more information about the disorder and treatment options.
Applications in medicine. Pain from disc herniation, the leading cause of sciatica, usually resolves within several weeks with conservative therapy. In patients with sciatica, for 6 weeks, pain relief is faster with surgery than with conservative therapy. However, outcomes are similar at 1 year.
Is located the intervertebral disc. This is the condition of a normal lumbar intervertebral disc. As a disc degenerates and breaks down, the inner core can leak out through the outer portion of the disc. This condition is known as a disc herniation, which puts direct pressure on the nerve.
Symptoms. It is common for a herniated disc to press against or inflame a nervy nerve, causing pain to radiate along the length of the nerve. A lumbar herniated disc is the most common cause of sciatica, leg pain along the sciatica nerve down the back of the leg. These are some general characteristics of lumbar herniated disc pain. leg pain, nerve pain, variable location, and neurological symptoms, foot drop, lower back pain, quick onset, pain that worsens with movement, pain that worsens from hunching forward.
Well, if you've been suffering from an excruciating pain in your back, it's time to take charge and find relief. And here to tell us how is Dr. Adewale Aderenan, a spinal surgeon with the San Antonio Orthopedic Group. Good morning, sir. How are you?
I'm good. How are you?
It is good to see you. I'm glad to see you here. You know, anytime we talk about back pain, we're wondering, okay, what exactly could it be? What is bothering us so greatly? And it could possibly be lumbar disc herniation. Is that right?
That's right. There are many causes of back pain, but one of the most common things that causes back pain and leg pain is a lumbar disc herniation.
And what exactly is it?
Well, if you look at somebody's back, we've got a model here. It's just a series of bones separated by these gelatinous discs. And they act like a shock absorber in a normal person. But as you get older, the discs dry out and they can become fragmented. And a piece of it can spit out into the spinal canal and press on one of the nerves as it goes down.
Okay, so when you say disc, this is exactly what we're looking at right here. This is a disc, and it could possibly be damaged.
That's right. It gets damaged from trauma, from age, from any of a number of things. But a piece of it can spit out and it presses on the spinal nerve. It can cause really bad back pain, really bad leg pain as well.
That is why you need your back for everything. Every activity, every movement, you name it.
You wake up in the morning, you're moving your back right off the back.
Yes, exactly. And so some of the symptoms then of disc herniation are what?
People can have really bad back pain from it, but the classic finding is usually pain that goes down your leg, and it can also come with numbness, it can come with tingling, it can come with weakness depending on how hard it's pressed on a nerve and which muscle.
You know, doctor, that's disheartening because we want to be more active, we want to do more things, but if you're not taking care of your back, that's horrible. That's a bad feeling.
It is, and I think for sciatica, lumbar herniated disc being one of the most common reasons, it's commonly undertreated. A lot of people out there who are suffering from this problem who have never seen a doctor or a spine surgeon.
You said sciatica. What exactly is sciatica?
Sciatica is a general term for pain that goes down your leg. There are multiple causes, but lumbar herniated disc is one of the most common.
Because I'll hear these terms and I'm wondering what exactly are people talking about. Luckily, I haven't had to, experience too much back pain, but it's one of those words that you think, okay, what exactly are you mentioning? So it's the actual feeling, right?
That's right.
Okay,
so pain and numbness, tingling down your legs, most people call that sciatica.
That is sciatica. And so some of the common lumbar disc herniations, you mentioned that you want to make sure that disc is healthy.
That's right. There's no, over time your discs become degenerated anyway. There's no way to really stop that process. But the thing that causes pain is when it shoots out and presses on the nerve.
Oh, that sounds just bad.
Yeah, it can be pretty miserable. But
Yes.
there are treatments for it. There's non-operative treatments, and I think a lot of folks are afraid of back surgery, but back surgery works really well for this condition.
Okay, so when you say treatments and back surgery, those two come hand in hand, correct?
They do, in my opinion, yes.
Okay, and so how do you know you're a good candidate for it?
We normally treat most people without surgery initially. Folks who fail surgery are great candidates for lumbar disc herniation.
Okay, so if you'd like more information, you can certainly call the San Antonio Orthopedic Group. They've got 7 San Antonio locations. There's the number on your screen, or you can also check out their website, tsaog.com. And thank you again, doctor, for being here.
Thank you very much.
Diagnostic. Sciatica is usually the first clue to disc herniation, but sciatica may be mimicked by other disorders that cause radiating pain. Because more than 95% of lumbar disc herniations occur at the L4 to L5 or L5 to S1 levels. The physical examination should focus on abnormalities of the L5 and S1 nerve roots. Plain radiography is not useful in diagnosis disc herniation, but more sophisticated imaging myelography, computer tomography, or magnetic resonance imaging should generally be delayed until a patient is clearly a surgical candidate.
The spinal column can be divided in the following segments: cervical, thoracic, lumbar, sacrum, and coccyx. Spinal disorders can occur in any of these elements. The intervertebral discs act as shock absorbers for the spine. The spinal column undergoes degeneration with age. Sometimes these discs can degenerate, thin, or herniate. When this occurs, pressure from the two vertebrae coming in contact with each other can compress the nerve and the spine, resulting in back pain. In severe cases, repair of this disorder requires spinal fusion. Many patients with back pain, leg pain, or weakness of the lower extremity muscles are diagnosed with herniated disc. When disc herniation occurs, spinal disc is pushed outside its normal position, diminishing the space for the nerves. This spinal nerve compression can lead to spinal stenosis, where it involves more than one disc to prolapse. The surgical treatment of herniated disc in the lumbar region is called microlumbar discectomy. In this process, the surgeon makes an incision over the center of the back. He then uses the interluminal space to access the prolapsed disc microscopically and relieve the spinal nerve compression. Once it is removed, the spinal nerve gets decompressed into its normal state, giving relief to the patient. Spinal fusion is a surgical technique in which one or more vertebrae of the spine are united or fused together so that motion no longer occurs between them. This procedure involves removal of the damaged disc and replacing it with PEEK cage. The cage is inserted where the disc has been removed. Finally, to provide stabilization, small pedicle screws are inserted for steady healing and long-term fusion.
Conclusion. Herniated lumbar discs were making a spontaneously increased amount of matrix metalloproteinase, nitric oxide, prostaglandin E2, and interleucin 6. These products may be involved intimately in the biochemistry of disc degeneration and the pathophysiology of radiculopathy. Their mere presence implicates biochemical process in the intervertebral disc generation.
Ready? Okay, good. Okay, we're going to be demonstrating how to work a disc, a lumbar disc, to get a correction here. But also, 50% of all lumbar issues are coming from somewhere else. We can also see that in the thorax and cervical area, there's a lateral deviation on the right-hand side and the left-hand side here. There's the patient facing us. I'm going to show you how to do abdominal suspension with lateral flexion with a drop, okay, to open up that disc area. And we're doing this for a patient from Singapore, so we got to find some doc in Singapore that's going to continue on our work. Okay, so. Okay, now we're going to do extreme abdominal suspension. And what this is going to do, it opens up and creates a negative pressure on the front or the anterior aspect of the disc. Now, since there is a slight deviation of the buckling, I'm going to distract out, and this is actually opening up that disc area. Now, opening up that disc area, again, remember, you don't have conscious control of these muscles. There's a slight increased tone on this left aspect as compared to that, so it's distracting. And after I do it about 3 or 4 times, the muscles are relaxed, and so that means that the joint mechanoreceptors and the facets, the disc is hydrated enough to where the muscles are relaxed. So now, you never want to mechanically relax them with like a massager or hot pack or ultrasound. That's not chiropractic. What a real chiropractor is going to do is distract the joint and turn off the reason the muscles are firing. Now we're going to be setting both drops, and we're going to contact right on the lateral to the paravertebrals. Going to laterally flex into this and then drop. And that drop opens up and changes the shape of that ligament. So again, we're going to do it one more time where we set the drops, contact, distract out, laterally flex, and drop. And that creates a negative pressure on the opposite side or contralateral side. And then now everything's relaxed, even, perfect. You do that enough times, you're going to regenerate the disc, and that's going to eliminate any